Philadelphia's city health centers offer very low-cost health care to all residents of the city but are overcrowded. Public Health Center 10 on Cottman Avenue is the only one city health center serving the entire Northeast, it taking up to a year for a new appointment. 2 new health centers are included in the Philadelphia city budget in the lower Northeast, one at the Frankford Transportation Center Bridge and Pratt and one at the Old Friends Hospital on Roosevelt Blvd, near Langdon St. They will provide care for over 46,000 patients a year, mostly at the Friends site. There is opposition to the health center at the Friends Hospital site, despite the critical need for more capacity for city health centers. The opposition can put a 5 years delay for the city to locate another suitable site. Therefore, community, religious, labor, immigrant, and social services organizations have come together forming an informal coalition to support the health department's plan for the 2 new health centers. The coalition has gathered more than 1,200 signatures supporting the Friend Hospital Health Center. Councilwoman Quetzi Loizada and the Philadelphia Department of Public Health held a series of public meetings to allow community members to provide input to this project.
I work with immigrants from many parts of the world, and I hear these stories that because they cannot make an appointment at the health center on Cottman Avenue, they have to go to South Philadelphia, to Center City, to West. They have to travel long distances. They have to spend money. They have to give up working days. It's a lot, and it's just not fair. Or if you look at the statistics of growth population in the Northeast, you will find that almost every zip code has between 24 to 26% of foreign-born population. It means that population has grown, but city services have not grown. Actually, they've been reduced.
Our neighborhood group was asked if we would support the Mazzoni Center moving in to our neighborhood. And I have to tell you, our neighborhood at first was opposed. We were very concerned about the science and what it would do to our neighborhood. We did have some religious leaders who came and said to us very, very forthrightly, "What are you doing? Don't you believe in all of what you say you believe?" And the community finally said, "Okay, stop fighting." Here we are, 3 years later. They have been great neighbors. They have helped the neighborhood tremendously. In fact, we actually now have the opposite problem. They've been so great for our neighborhood that property values are going up. And if we could talk to the former council person and the current council person, please don't reassess us. We should have opened our arms and said, we need health care. Waiting a year can be a death sentence. They would see how successful it's been and how right they were to put it there and how wrong the neighborhood group was to fight. Thank you.
So I think I'm in a unique position because I'm currently working as a pharmacist at the Friends Hospital, as you can see on my name tag here. So with the selection of the Friends being a potential site for the new health center, we already know the benefit. The question now is where would be the good location that benefit the community. So through my informal kind of communication with the internal staff at Friends, we are all really supporting and hopefully for the plan to become, fruitful, become fruition. In medicine, we are weighing the risk versus the benefit ratio. Whatever treatment you choose, whatever medication you choose, the benefit gonna outweigh the risk in order for us to implement that treatment. And here, using the benefit to the community for generation to come, as we're gonna serve across the lifespan, from pediatric to senior to adult medicine. I think in this case, the benefit is really outweigh the risk, which can be safely managed. There is a will, there's a way.
In 2020, we put speed cameras on the boulevard, and they are having a profound effect on traffic safety. And we projected that we have saved 36 lives by putting those up. We're going to be spending over $100 million on traffic safety improvements on the boulevard. That'll be complete by 2029.
Friends is a perfect place for this. It's big, it has parking, it has, it's accessible. People will go there. I just think we should make up our minds to build it and build it fast.
My name is Pearl Min Chu Hoen. I'm the president of the Northeast Philadelphia Chinese Association, and I have a very tight connection with Health Center 10. 6 years ago, I was working as interpreter, Chinese interpreter at Health Center 10 for 3 years. Every day I see people come and they need appointment. We help them make appointment. But our heart was broken because we cannot get them an appointment soon enough. And most of these people are regular immigrants. They're underserved. They don't speak English. And meeting like this, you want the community to come, those people don't know about it. They didn't show up. So if you want to hear the voice of the community, you usually don't hear it, but don't ignore their needs.
Yes.
You know, you may think like you're concerned about their safety, but there's no safety if you cannot treat yourself and you don't have the money. So the healthcare is really urgent. You know, every day I pray that we have more health centers to let these people get help.
And I would tell you that there are people from the zip codes that Health Center 10 serves that come all the way to our health center for an appointment because they can't, it takes longer at Health Center 10. The people of the Northeast for years have been looked upon as if they have everything. But this is not true. This is a healthcare disparity that's happening in the Northeast, and every single health center advisory council needs to be supportive of this. Health Center 5 Advisory Council, we're on board with you.
I think the way you described it as a public health desert was, honestly, I can't think of a better way to word it myself. I also think the specific location of Friends is brilliant when you have both a hospital there and the, what's it called, community mental health center right there. So right in the spot, you have social workers, you have the health center, you have so many resources that people would need in one location, which is great.
My name is Katie, and I'm representing Oxford Circle Christian Community Development Association. One of the things that comes up a lot is a need for a quality healthcare center in our community. Our social workers tell me we don't even bother recommending Healthcare Center 10, like you were saying from the graphs, because the wait times can be, like you said, up to a year. As the population grows rapidly this decade, it makes so much sense to us to have another health center. The other thing we wanted to add is we as an organization did a community survey last year where we invited over 100 community members to participate in naming things that they see as assets in our community and also things that they would like to see more of or see improved. And the health center was one of the top 5 out of like 40 things. Furthermore, in the focus groups, participants specifically asked for a clinic with staff speaking Spanish, as well as other languages that are popular in our community. The respondents also mentioned wanting access to vaccinations. We had no trouble getting some signatures and agreement from everyone that we work with, that we spoke to, and in support of building this health center here. So thank you so much.